Do you know how to identify a urinary tract infection during pregnancy? It's more common than you might think. Now, to start with, a urinary tract infection, or UTI, is simply an infection in any part of the urinary system, which includes kidneys, bladder, ureters, and urethra. It typically arises when bacteria sneak their way into the urethra and start to multiply. While anyone can get a UTI, pregnant women are particularly susceptible. Why, you ask? Well, hormonal changes and shifts in the position of the urinary tract during pregnancy make it easier for bacteria to travel up the ureters to the kidneys. And, as it turns out, about 10% of pregnant women experience a UTI. So it's not something to be brushed aside. Knowing the signs and symptoms is crucial for early detection and treatment. Pay close attention to the following information. Let's explore this subject a bit more, shall we? Urinary tract infections can sneak up on you. They might start as seemingly harmless symptoms, but can quickly escalate. It's important to know what to look for, as early detection and treatment can help prevent complications. One of the first signs of a urinary tract infection or UTI is a change in your urination patterns. You may find yourself needing to go to the bathroom more often than usual, a condition known as frequent urination. This can happen even when your bladder isn't full. It's caused by the infection inflaming your urinary tract, making you feel like you need to urinate more often. Another common symptom is painful urination, also known as dysuria. This can feel like a burning sensation when you urinate. It's caused by the bacteria in your urinary tract irritating the lining of your urethra and bladder. You might also experience lower abdominal pain. This discomfort is often felt in the pelvic area and can range from a dull ache to sharp pains. It's a result of the infection causing inflammation and irritation in your urinary tract. Some women with a UTI may also develop a fever. This is your body's way of fighting off the infection. However, a high fever during pregnancy can be concerning and should be addressed by a healthcare provider right away. In addition to these symptoms, you might notice that your urine looks different. It might be cloudy or have a strong, unpleasant smell. This is due to the presence of bacteria and white blood cells in your urine. It's important to remember that not everyone with a UTI will experience all of these symptoms. Some women may have only mild symptoms or even none at all. However, if you notice any changes in your body or feel unwell, it's always best to err on the side of caution and seek medical advice. If you experience any of these symptoms, it's important to reach out to your healthcare provider immediately. Early detection and treatment of a UTI can prevent further complications and ensure both you and your baby remain healthy. Ignoring a urinary tract infection during pregnancy isn't an option. It can lead to serious complications if left untreated. Let's delve into what these complications might be. First, we have preterm labor. This is when labor begins before the 37th week of pregnancy. Having a urinary tract infection can increase the chances of this happening. Why? Because the infection can cause inflammation in the urinary tract, which can then trigger contractions. This isn't ideal because the longer a baby can develop in the womb, the better. Next, we have low birth weight. Babies born prematurely often weigh less than babies born after the full term of pregnancy. This is because they have had less time in the womb to grow and develop. If a urinary tract infection triggers preterm labor, it may also result in a baby being born with a low birth weight. These babies may face more health challenges after birth and may require a longer hospital stay or specialized care. Finally, a urinary tract infection in pregnancy can lead to a higher risk of perinatal mortality, which is the death of a newborn up to 1 week after birth. This is a grave risk and one that underscores the importance of managing a urinary tract infection promptly and effectively during pregnancy. These are just a few of the potential complications associated with urinary tract infections in pregnancy. They illustrate why it's so crucial to pay attention to your body and seek medical help at the first sign of a urinary tract infection. Remember, these infections are common and typically treatable, but if left unchecked, they can lead to serious problems. So what's the takeaway here? It's simple. Don't ignore the signs and symptoms of a urinary tract infection during pregnancy. If you suspect you have one, get to a healthcare professional right away. Don't take any chances. Seek medical help at the first sign of a urinary tract infection. The good news is, urinary tract infections are treatable, and the sooner you start treatment, the better. So let's delve into the various treatment options available for urinary tract infections during pregnancy. First up, we have antibiotics. This is usually the first line of treatment recommended by healthcare professionals. Antibiotics work by killing the bacteria causing the infection, thereby providing relief from symptoms. However, it's important to note that not all antibiotics are safe for use during pregnancy. Your healthcare provider will carefully select an antibiotic that is both effective against the bacteria and safe for you and your unborn baby. Next, let's talk about home remedies. While these may not replace medical treatment, they can complement it and help alleviate symptoms. Drinking plenty of water, for instance, can help flush out the bacteria from your urinary tract. Unsweetened cranberry juice is also often recommended, as some studies suggest it can prevent bacteria from sticking to the walls of the urinary tract. Lifestyle changes are another way to manage and prevent UTIs. Regular urination, for example, can help clear bacteria from the urinary tract, reducing the chance of an infection. Wearing breathable cotton underwear and avoiding tight-fitting clothing can also help prevent the growth of bacteria. In some cases, your healthcare provider might recommend a treatment called prophylactic antibiotics. This is a low-dose, long-term antibiotic treatment designed to prevent recurrent UTIs, especially if you've had multiple infections during your pregnancy. Remember, it's crucial to follow your healthcare provider's advice and complete the full course of any prescribed treatment, even if your symptoms improve before the treatment is finished. This helps ensure that all the bacteria are killed and reduces the risk of the infection returning. Your health and your baby's health are paramount. Don't hesitate to seek treatment if you suspect a urinary tract infection. Pregnancy comes with its share of challenges. A urinary tract infection shouldn't be one of them. We've learned today that these infections are common but manageable, especially when identified early. This is why it's essential to recognize the signs and symptoms, such as a frequent urge to urinate, discomfort during urination, or lower back pain. We also discussed the potential complications if a urinary tract infection is left untreated during pregnancy. These can range from premature labor to low birth weight, making it crucial to seek medical attention if you suspect an infection. Finally, we explored various treatment options. These include antibiotics safe in pregnancy, drinking plenty of fluids, and avoiding irritants like caffeine and spicy foods. Remember, knowledge is power. The more aware you are of your body's changes and signals, the better equipped you'll be to ensure a healthy pregnancy. Stay vigilant, stay healthy, and remember, when in doubt, always consult your healthcare provider. Thank you for watching, and if you found this video insightful, please like, subscribe, and hit the notification bell to ensure you receive future videos posted to the channel. Also, please share with a friend or family member or anyone you believe may benefit from it. Blessings to you!